Well, welcome, Sister Marian, to our podcast, Rooted in Love. I've been looking forward to it because we've known each other for so long.
I know. Before you got married.
Before I got married, before the
Yeah.
kids,
Yeah.
and I've learned a lot through you in my career. You've really influenced my career path. I don't know if you know that. We
Thank
have
you. That's nice to know.
no, no, and just thinking about you, Sister Marian, sharing with us a bit about your journey. Where you grew up, your commitment to community, which is something that I've always really admired. A nurse, healthcare executive, and now you're in general counsel. You can share a little bit about who you are.
Okay, well, let's start. I was born and raised in Pomona.
Mm.
Um, my mother is from Mexico.
Hmm.
She came to the United States when she was 22 when she married my father.
Wow.
Uh, well, by the time I came along, lived in Pomona. My father worked at Convair in Pomona.
Hmm.
Um, when I was 5, my father got really sick, and all of a sudden, my mother had to take over things. My mother was raised on a little ranch in Mexico. She never went to school. She
Mm.
barely knew how to write her name.
Mm.
So all of a sudden, a person now has 4 little girls and has to take over doing everything without knowing how to read or write. I have to say, my mother, sisters would tell me, Mary, you work too much. My mother would probably laugh because she would say, my mother at any given time had 2, 3, 4 jobs. Trying, we were never homeless. We were never hungry. Sometimes we ate things that today I think I don't know where she found a bunch of lamb hearts, but we were eating lamb hearts.
you
And
know,
anything to
do
give
what
us
you gotta
food, we
do.
got through. Um, what I'd say one of the highlights of my childhood was the Sisters of St. Joseph.
Oh.
Um, my father was reading the newspaper one day. This is when I was in second grade. So I was in kindergarten. My father got sick and saw in the newspaper that the Sisters of St. Joseph were opening a new school.
Um,
What made that take particular interest to my father is the principal, Sister Jacqueline, had taught his sister in Daly City.
oh wow.
So my father had been taught by the Sisters of St. Joseph of Orange in Daly City.
Mm.
He recognized her picture, so he and my mother went to talk to the sisters, and then we went to school there. At first, my parents tried to pay tuition, and it was so cheap. It was $15 for a family,
For
but
a
that was
family,
a
it's
huge
still,
expense.
yeah.
So basically, after I think my first year, the sisters, we paid nothing for Catholic education. Um, my older sister struggled with my father's illness and kind of stopped producing, just kind of went into her
Mm.
own little world.
Hmm.
Sister Jacqueline brought my sister back to life. So if I had to say the deepest appreciation that I have is that memory
Mm.
that Sister Jacqueline was instrumental
Hmm.
in making her become the person she used to be. Um, so growing up Pomona, eventually I left school. I started studying at Cal State Fullerton for whatever reason, and I can't really say why. I started attending Mass all the time and weekday Mass. And the Sisters of St. Joseph, where I had apartment in Fullerton,
Yeah.
were at St. Juliana's. And
Right.
so they saw me at Mass every day, so including a Sister Jean Bird, who
Mm.
later became the General Superior. So she came up to me, she goes, I know vocations start with coming to Mass. Well, anyway, I knew Kathy
Uh
Shinhoven.
huh.
Anyway, make a long story short, I entered the Sisters of St. Joseph when I was 21. I was young. I was only 6 weeks into being 21. I didn't know beans from hash. And the sisters, um, again, became very instrumental in how I thought, what I did.
Mm.
They blessed me with so many opportunities and things. What we are going to talk about is how did I
Hmm.
got into healthcare.
Yes, definitely.
Well, I had worked in a convalescent home to support myself before I entered. I
Ah,
was a certified nurse's assistant,
okay.
but you know what? Didn't like it. But it was the Jimmy Carter years, and you couldn't get a job.
The
So
Jimmy
I,
Carter year.
but I needed a job. So anyway, so then when they were thinking about what I should do after I left the novitiate,
Mm.
Sister Suzanne, who was the general superior at the time, and Sister Judith Fergus thought it was a good idea that I go to nursing school. I went to nursing
And were
school.
you open to that? Were you open to like,
Well,
I do want to go to nursing school,
I didn't
or
want to go to nursing
they
school.
saw
Then
something?
they
They
knew
saw
that,
the,
but they said, I want
oh,
to do social work. And we'll talk a little bit about, I
yes,
was introduced to Buena Clinton by
yes.
the missionary of charity, their brothers, Mother
Uh-huh,
Teresa's brothers.
uh-huh.
And that's how we learned about Buena Clinton and eventually became where L'Amistad was placed.
Yes.
All these things all fit
Come
together amazingly.
together.
So God works in amazing ways. You
Yes,
know, that my father sees a newspaper, that
yes,
I went to the Sisters of St. Joseph,
yes,
that the Jimmy Carter years forced me to work into nursing.
yes.
I went to when I novitiate. I spent time like a month living with the Missionaries of Charity Brothers in their
Uh-huh.
homeless shelter in right behind Santa Ana College.
All right.
Um, well, anyway, as you can see,
Yeah.
all these things fit together. While I was with the brothers, I saw, oh wow, I'm going to be a social worker.
Okay.
Well, then they said, no, we would like you to be a nurse. So I learned eventually, and I like the scripture. Jesus learned obedience through what he suffered.
Mm-hmm.
Learned obedience, and I learned grace.
Mm-hmm.
I did my very best, and all of a sudden, after I'd been a nurse for a year, I'd working at St. Jude's, I get a phone call. Now I'm still not under final vows, and I get a phone call from Sister Suzanne wanting to see me. And I thought,
Sassus?
yes, and
Oh.
I kept thinking, oh dear God, what did I do? My letter was was supposed to submit my letter to renew my vows
Uh-huh.
so this is in March. She wants to meet me the first week in
You
April.
remember.
Yes, because I was panicking because my letter's due, and is she wanting to see me to tell me don't bother to write the letter?
Oh.
That's the only thing, because of those days, the general superior never spoke to people in formation.
Oh.
That she wanted to meet with me one on one. I thought, oh, dear. Pat Haley was the secretary who called and said, Sister Suzanne wants to meet with you. So they went there in fear and trepidation. The first thing she goes, I got your letter. I said, no, you didn't. I haven't written it yet. Well, she's talking about a letter that I wrote the summer before with some other sisters
Oh.
about Buena Clinton and about could we do a work in Buena Clinton. I got your letter. You talked about moving there and living there and blah, blah. She said, no, what I really would like to do is something more concrete.
Hmm.
And she said, we'd like to start a free clinic, and we'd like you to be among the starting group. Now, here I was trembling because I'm thinking, my,
What did I do?
was I not okay or was something wrong? And instead, she's entrusting our first ministry out into the community with a temporary professed. All of a sudden my world changed.
Yes.
And I found out it wasn't nursing that I really was not attracted to. It was the hospitals and the structures of
Oh.
facilities.
Uh-huh.
Once I was out in the communities, like had free reign. I, you know, I wanted to be a social worker. Guess what? I did far more social work
Mm-hmm.
as a nurse. And it was the opening where people felt free to come forward
Yes.
and talk to us about their needs, their health,
Yes.
what we could do to help them. So all of a sudden, I did far more social work as a nurse than I ever did. I did that for a length of time. Eventually, Kit Gray asked me to go into administration.
Mm-hmm.
It was about the year 2000, 2003. I went formally to St. Mary's. Um, and then, I became a nurse practitioner after I made final vows. So going backtracking a little, and then I helped start a free clinic for Santa Rosa Memorial.
Oh, okay.
And then after that, that's when Kit Gray sent me to actually Mission Hospital
Right. In South County. Yes.
because we had just purchased it and they needed community benefit and there was no program yet.
Mm-hmm.
So they had made a connection with communal health centers and I became a donation. That's how they
Right.
started the first year with community benefit, trying to say we're now a nonprofit. We're not a for-profit, physician-owned. We're faith-based. We're nonprofit. Anyway, starting there, I started doing some administration.
Mm-hmm.
Martha Ann went on sabbatical. kind of temporary things.
Mm-hmm.
I think I'm talking too much, but
No,
no.
no, but yeah, because I think what when you're talking, and I remember because I know your story, but it's also your lived experience. So it's your passion to education, to serving, right? And your lived experience, especially the story about your sister,
Mm-hmm,
and how the sister at the school helped her heal,
mm-hmm.
and really thinking about in healthcare, what can healthcare learn about healing? Given
Oh.
your lived experience, and as a nurse practitioner, and as a healthcare executive, you're kind of like in both worlds.
Well, I was blessed. You're right to bring that up. Um, I we can heal bodies. I'd say more to cure bodies. True healing happens when people are respected. We talk about holistic care,
Hmm.
body, mind, and spirit.
Right.
For example, Sister Jacqueline, you know, it Isabel looked physically okay, but wasn't. And Sister Jacqueline knew what to do. She brought Isabel out of her shell. She was
Hmm.
kind. I remember when Isabel was in sixth grade, she had appendicitis and had an appendectomy. And the sisters came to our house, Sister Rosalia and Sister Jacqueline,
Hmm.
and to visit Isabel. And they brought her two brand new dresses. We never had brand new clothes. And then those two dresses became hand me downs. I remember wearing them later on in my life. But the fact that Sisters One came to
Yeah.
us, when we're going to talk about
Hmm.
what the difference between waiting for people to come to you versus you
Right.
coming to them,
Proactively, yes.
and that they cared enough and they thought about Isabel in a way that Isabel wasn't thought about in her own self, I don't think. My
Hmm.
father my father was sick, my mother was so busy that she felt special in the eyes of Sister Jacqueline
Yeah.
and Sister Rosalia.
And you're touching on the dignity,
Yes,
right? The dignity that they saw in Isabel, and how do we see that dignity in practice?
yes. Well, part of it is, when I used to do a lot of orientation,
Hmm.
I would always talk about, I'd start with the value of dignity always because it becomes the motivator behind everything else
Hmm.
that we do.
Hmm.
If we're made in the image and likeness of God, then we see the world entirely different. We see the people of God entirely different.
Yes.
And even when we struggle, we disagree, we have issues and problems, if when we start focusing there,
Hmm.
our world looks different.
Hmm.
One of the things that I think right now, is that we seem to be in a scarcity model. There's
Yes.
just not enough. And that's a temptation, but a truth. One of the things
Hmm.
about sometimes is truth gets mixed in with non truth
Hmm.
because it becomes just about scarcity
Hmm.
versus abundance. In the eyes of Sister Jacqueline and Sister Rosalia, there was tons of abundance. They brought forth love and caring in Isabel that brought Isabel new life that then then gave me new life. I think God calls us in different ways,
Hmm.
but the Sisters of St. Joseph made a huge difference in my life. And, you know, um, I learned from them what tenderness, what kindness, what abundance means.
Hmm.
I've tried to bring that wherever I've gone. And the temptation though is when I feel like I get lost a little, we start going in that scarcity model.
It's so true. And what you've also shared, sister, is you become an NP, nurse practitioner, at an amazing school, which
Hmm.
in San Francisco, and you realize when you're in the community setting, you felt free, you felt all your gifts aligning
Hmm.
with the community. So reflect a little bit about what that experience in the community can be offered as a learning to healthcare, to the traditional healthcare institution.
Well, like I said, I think if you were to talk to Sister Jane Francis Dunn, they were leaders in Catholic healthcare in our system.
Mm-hmm.
They would be so proud and truthful to saying, we never turned anyone away. Not only did we not turn any away, but we always did our very best. All of a sudden, we started, our focus changed. I think Sister Suzanne and Francis Dunn actually was very important in this. Francis Dunn had been the administrator at St. Joe's. We didn't have a way of paying for all this, but there was a desire to say, we're not just waiting for people to come to us, we need to go out.
Mm-hmm.
And so when Sister Suzanne asked me to come see her, now she said, now you can't tell anybody. Well, here I'm jumping for joy and I can't tell anybody. Why? Because one, she says, we don't have board approval.
Right.
And we don't have any money yet. So Francis Dunn brought the idea, went to the board, and I think Sister Michaela was involved as well as Suzanne,
Mm-hmm.
and said, she told the board, what if we just took 3% of the net of any income so that we could do this program?
Mm-hmm.
And the board approved it. So, which then became the precursor to the 10%, to the tithing.
Mm-hmm.
But it first was 3%, and that's how we built and paid for L'Amistad.
Mm-hmm. Which is still with us.
I know, and
it's
doing
still
amazing work.
Amazing work, providing access to care,
yes,
and to healing.
And it started out with something so basic. I remember Francis Dunn. Francis Dunn was a truly a prophetic witness model to me. But she said to me once, she goes, I can't do what you do. I can't go out in the community and do all these, but I know people and I know systems and I know how to make things happen.
Mm-hmm.
So if you're ever in need, you come see me. I will help you. That was Francis Dunn, an amazing leader. Mm-hmm. And that's how we started. Then that became the model. Next thing I know, St. Jude's came to visit us. They decided they wanted to do mobile clinics rather than a stationary clinic that we had in Buena Clinton. Mm-hmm. When I went to graduate school in San Francisco, I was a board intern at Santa Rosa Memorial. They knew I was finishing and said, will you come here and do at Santa Rosa what you did here and involved in here? Mm-hmm. So I helped start that clinic up there. And then I was called to mission because they needed to transition. Yeah. So I had the opportunity to be involved in a lot of good things about going out, mm-hmm. not waiting for people to come in. Mm-hmm. And I think that was a turning point for us. Like I say, I just happened to be blessed to be in the right place, maybe at the right time, or, that anyway, it worked out wonderfully. And it became the model all the way around.
It did. And we talk a lot about at the fund about community power. Yeah. And the network. The Sisters of St. Joseph are truly a network. Mm-hmm. Everyone has their gifts, their lived experience, and a vision. Mm-hmm. Right? So you had Sister Suzanne. You had the vision with the letter. Mm-hmm. Sister Suzanne's like, we have to make this happen. I don't know how. Mm-hmm. It's going to happen. And that's community. We're going to figure this out. Then you've got Sister Francis Dunn saying, I don't know how you do it, but I can get you some cash, some money.
The help, all the help you need.
And you were the connector throughout the state.
Well, what was interesting is Sister Michaela, when I think about it, okay, remember I told you I saw Suzanne in April. Mm-hmm. We don't have board approval. We don't have any money. We don't have anything. We started seeing patients in November. Sister Michaela, I have to say, a person who could get things done. I can't think of anyone. When I think of saying, tell us a beautiful story about Sister Michaela, is that I can't imagine anyone else being able to go from nothing to seeing patients in how many months is that? 5? Mm-hmm. We were blessed to be able to, and we had no model. We had no, had to find a piece of property, get licensed. We had all these things, in 5 months. I remember writing policies and procedures when I didn't know how.
but I also think about the power of community. You had trust in the community. You had friends.
Yes.
And you were very committed to addressing what you saw as a need in the community. And that 3% became the 10%, which became the St. Joseph Fund.
Yes.
The work of the fund.
It was amazing. And also when you talk about relationships, my first year in the community, I was in La Habra, and one of her sisters there, she would go around and visit all the grocery stores and restaurants and get all the dairy old bread, whatever. Mm-hmm. She then had a system with a bunch of other sisters where they visited any place that could utilize food and give food away to people that couldn't afford it. Mm-hmm. So she happened to get sick that year, and she said to me, will you take over getting the bread? She went up to Eureka. They told her that she needed to rest. So I went and took on her rent. And one of the places she went to was the Missionaries of Charity.
Okay.
So they were again behind the school. So when I was a novice and Judy was trying to find places, she goes, I heard that you met the brothers. Could you
Mm-hmm.
take me to see the brothers? The brothers went to Buena Clinton. That's how I knew about Buena Clinton, how we wrote the letter.
Mm-hmm.
All these things were like the stars were aligning, that God was
Yeah.
calling us in new ways through our
Our
relationships.
relationships. And you served as a healthcare executive, so you
Yeah,
understand that world very well.
yeah.
And really thinking about the next generation of healthcare leaders, what advice would you give them, given your experience?
I would say one is, we've talked about the scarcity and abundance. Don't live in scarcity.
Mm-hmm.
Um, there's always abundance of caring, love, that healing that we talked about.
Yes.
When we get into the scarcity model, our vision becomes very small.
Yes.
We need a vision is expansive, and I think relationships are key to that. What we cannot do
Mm-hmm.
in our relationships, we can do.
Mm-hmm.
I can bring this if you can bring this. I remember when I was in Napa, we changed our community benefit committee. It started out very kind of, and I sat down with Dana Codron and a physician, Dr. Carrillo,
Mm-hmm.
and we said, okay, what are all the different needs in this community? Because at that time, the Queen was in negative numbers and we didn't have the money. We were used to give out lots of grants. All of a sudden, we didn't have the money.
Right.
So what we did is said, let's bring everybody together. What can you bring? And I promised, I said, when have more dollars, um, I I'm generous and I believe, but right now
Mm-hmm.
we don't. So what
Mm-hmm.
can we do without it? So our community benefit committee became like 16 people, different, like we had represented from the police department. We had
Mm-hmm.
representatives from Head Start. We had represented from the local politician's office. We all around the table, all saying, how can we make it work here in Napa County? We were able to do that. And that sustained things even when times were tough. So these are tough times.
These are tough times.
How do you, through your relationships, build
Mm-hmm.
community? And
Mm-hmm.
then again, abundance, there's always more and overflowing, kindness, goodness, generosity,
Mm-hmm.
thoughtfulness.
Mm-hmm.
These are the things that are never in short supply. If you start focusing, though, only on what you don't have, you start thinking less about
Yes.
those things. And I'll be honest, I'm tempted to go there oftentimes too.
It's so much easier.
What keeps me up at night is
Yeah.
thinking about, oh, what we don't, how can I do this?
Mm-hmm.
What can I, and like I say, if I had new leaders, don't get stuck there.
Thank you. Thank you for sharing that because you also bring forward the formation we've all gone through with the Sisters of St.
Mm,
Joseph. Is we're there and we bring the table and we invite people to the table.
yes,
We don't have all the solutions, we don't have all the money,
yes,
but we have those relationships. And for healthcare executives and for future leaders to understand, there's some big problems right now,
yes,
but we don't expect it to be solved just by them. To be
yeah.
open to community, to bringing others to the table.
I couldn't agree with you more. That has been the key to our success for since the beginning. When you
Yes.
talked about the sisters, I tell a lot of stories. I do a lot of history, pilgrimages, things. Always key to anything we did were those relationships. And I just, like I told you about Isabel and our sisters,
Mm-hmm.
how their influence and their kindness could do amazing things. I do believe they're part of my vocation, why I'm here.
Mm.
And so I think all those things become foundational if you
Mm-hmm.
focus in on that.
Mm-hmm.
Because if we focus in on the what we don't have, we lose sight
Mm-hmm.
of the grace. Grace is huge to me. The presence of God, that's how I interpret grace.
Mm-hmm.
God can be found in all loving relationships. I mean, that's a definition. Love changes everything. There's a song, I think, I call
Yeah.
that.
Yeah.
And so that there's always an abundance of love. I used to, when I used to talk about that with in orientations and stuff, I'd say, parents, you have one child, you get another, you didn't think you could, and you love them more and overflowing.
Yes.
You didn't think just your love of your partner was enough, and then all of a
Mm-hmm.
sudden you found more love, and
Mm-hmm.
it just multiplies and increases.
Yeah.
That's when we get into the benevolence model versus the beneficence. Beneficence are always never
I love
enough.
that.
Benevolence, there's always more.
So sister, as you were talking about the dignity of the person and love, it's hard not to think about Catholic social teachings. So please share a bit about how that is a framework, a lens that you also bring into this work.
Well, earlier we mentioned the word dignity. And
Yeah.
again, that's one of the hallmarks, the foundational pieces of Catholic social teaching. We, in subsidiarity, we then entrust that what the people that are mostly that touch things in their work and how they do it probably have the best solutions. We talk now about synodality. Synodality, then, to me, is how do you do that subsidiarity? Synodality talks about that we, instead of being top down, the church is very hierarchical. And synodality says it comes from the people up, that every voice is important. And so to me, other things that are key in Catholic social teaching to that as well, are, I think, a commitment, again, to the poor, a commitment to listening to the needs of everybody. Catholic social teaching, and our, actually, Pope Leo.
Right.
I remember we were in the room at Regina when they announced Pope Leo, and Kathy Schindel was sitting next to me, and we both turned to each other and said, "Rerum Novarum," that Pope Leo. And so that, by picking that name,
That was
he
everything.
spoke volumes.
Yes.
That he was going to say the highlight of my papacy is going to be Catholic social teaching. So the value and beauty of every person, how do we honor that? What works do we do? How do we do it? It's more, we always used to talk, about it's what you do and how you do it. That's what, to me, is Catholic social teaching. It's not enough what you do, but the spirit of how you do it. And that's that when I said, what is the impetus of love, dignity, the human person? Do I see God truly? God has a face. Do I see it? And if I do see it, all of a sudden my world is different. How I talk to you, how I treat you, how inclusive I am. So to me, we're going to hear a lot more. In fact, it's just AI, Pope Leo. Right. I haven't read it.
Well,
I've read pieces.
It's pretty long.
I know, I have it on my desk. And also there is a kit in case you're needing it.
Oh, there's a kit.
We can give you a website about how do you utilize it. And so it's, so I'll send you, in fact, the links.
I was going to use AI to give me a summary of it.
Yeah.
But
the kit is how do you implement it?
How do you,
But the fact that he's another key thing that's different, we've always looked at it, Catholic social teaching. He's like talking about Catholic social doctrine. He changed the word.
Yes, he did. You're right.
Doctrine.
Yes. And I see it as a blueprint.
Yes.
To love and what we're trying to do nowadays. And it doesn't have to sit within the church.
Yes.
Or just with Catholics.
No, and that's why it's an encyclical. It's a letter to the world.
To the world.
And that's, I think, what we've been doing all along in all our works in community benefit. We don't ask who you are, where you go, what you do. We started our clinics. We didn't put criteria in, are you this, are you that? We see that dignity, and the sky is the limit. You're all, we say all are welcome here. That's what the word Catholic means, is universal. Everyone is desired, is part of the human race, and by virtue of that is made in the image likeness of God. None of that, is highlighting that truth in what we do all the time. In healthcare, one of the things that Jesus did, he taught and he healed. We have inherited that sacred ministry directly from Jesus. It looks different than at the time of Jesus, but the concept, the belief, the understanding that God wants to heal. And like I say, curing and healing are not the same things. Hopefully we do both. But if we can't cure, we can always heal. We can bring people together relationships that are broken,
Mm-hmm.
persons that are broken. Isabel was broken.
Mm-hmm. It's so true. And I also think about serving the dear neighbor.
Yes.
And people always asking, why is the fund doing disaster response in Mexico? Because we see the community as global community.
Yes.
And it just isn't just sit here.
We don't have borders.
We don't have
Jesus
borders.
doesn't talk about borders about anyone. In fact, you'll hear about the story of the Samaritan woman. You'll
Mm-hmm.
hear the stories about, different people. Paul, he visits everywhere.
Mm-hmm.
He doesn't stop with the Jewish community.
Mm-mm.
He got Peter to understand that and accept that. So the church from the very beginning, that Matthew, the Gospel of Matthew has, go out and teach all nations, baptizing them. That wasn't like only this select group of people.
Mm-hmm.
This is the mandate of Catholic social teaching,
Mm-hmm.
that you go to everyone and you bring the good news of the gospel. And we're blessed in that we have that opportunity. And it takes different pictures at different times, what they give emphasis to. Catholic social teaching is now growing again. Now, what happens in a world that's becoming more automated? Pope, Pope Leo is very concerned that the individual may get lost
Mm-hmm.
in the complexities of things and in modern life, in particular systems that can work, maybe they're starting to suggest, better than people.
Mm.
And he's starting to say there is a worry here.
So true.
I can't wait to read the whole document. I've had glimpses, I've read little pieces, but I need
Mm-hmm.
to read it all together, and then I'm going to really work we're going to apply the kit. I think especially the congregation.
That's a good idea.
Um, but it's, again, another opportunity for formation.
Mm-hmm.
How do you apply Catholic social teaching in a modern day?
And how do we continue to make sure we see the community and
Yeah.
the community feels seen,
Yes.
right? Even before AI.
Yes. Oh, Guy, the needs are so great. And where do you start? Sometimes that becomes, but it starts with little things. When I was introduced to Buena Clinton, to be frank, we were, brothers they knew of a family that was there, and there was a wealthy family that said, we'd like to pay for a group of children to go to Disneyland.
Mm.
And they said, but they have to be at least 5, I think was the cut, because they're too little. We don't know how to, but so they took so they went and picked a bunch of kids up. They gave them a number from Buena Clinton and also from the from the homeless shelter.
Uh-huh.
And there were some little ones, and they were crying because their older brothers and sisters could go to Disneyland and
Oh,
they couldn't go. So at that time, Jim Dempsey, he was a brother.
right.
Uh, we went and they were crying. So we said, oh, well, let's go out for ice cream. We'll go to the park and we'll go do this. And turns out they didn't have clothes to go, shoes. We went out and bought clothes and shoes because, anyway, it started small.
It's so small.
Little kids that were crying. One time I was there when we were in Buena Clinton, and this mother had placenta previa and was bleeding, started to bleed
Oh
early,
my.
had to be hospitalized. Father had a bleeding ulcer as well. There were like these little children, I think there were 4 or 5 of them. I then said, I'll take care of them. And I think, now what do I do?
Right.
So I called up Sister Helen Louise, who's in charge of the mother house.
Uh-huh.
And I said, I have these little kitties. Can I bring them to the mother house for dinner?
Uh-huh.
And she said, yes, bring them to dinner. So here we did, all these little kitties. We walked in the mother house dining room, and they were all staring, their little children. And they sat and had dinner. Next thing I know, sisters are coming to the table. They had gone to their rooms. I have this candy in my room.
Oh.
I had this little dolly. I had these toys. Pretty soon there was an abundance
Mm-hmm.
around the table that the poor were among us, and they were sweet and little, and
Mm-hmm.
how could they not give?
Yes,
And so it starts with small things.
it
If
does.
big things happen, but they build on the things that touch our heart. So all of
Mm-hmm.
a sudden, we're open to new ways of doing and new
Mm-hmm.
people and new
Mm-hmm.
opportunities.
Yeah.
Again, they didn't know the children of Buena Clinton, and I brought them to the mother house by a
Yeah.
fluke.
And you think about the importance of belonging and for the sense of the children to feel like they belonged,
Mhm.
they weren't othered, and the sisters to also think about this is our community
Yes.
and we're going to give them love.
Yeah, and, the fact that they left the tables and started finding things and were all of a sudden coming,
Mm.
you know, I just remember that because at that time the sisters had just said in our chapter we'll have a preferential option for the poor.
Okay.
And the big question was, well, who are the poor? Well, guess what? They were at our mother house
Mm-hmm.
and they were having dinner.
Mm-hmm.
And all of a sudden, the generosity of the sisters was natural, just like it was in Pomona
Mm-hmm.
with my family.
Yes. Yeah, and you bring us back to the beginning of your life
Yes.
and your lived experience and how you've, um, in my opinion, have really taken all of these experiences that were not easy, losing your father, um, knowing that your mother was working very hard, and and then bringing it to your career choices, even though sometimes it wasn't your choice.
Well, God knew.
But God knew, and you
God
were
knew.
open to that. You were open to being called.
Yes.
And then starting the clinic that became a whole network of community clinics for St. Joseph Health. And a lot of them are still with us,
Mm-hmm.
and they're now FQHCs,
Mm-hmm.
more sustainable.
Yes.
And making sure that anyone who walked through those doors were seen.
Yes.
They weren't a number.
I never turned people away, and
Never.
I got that, from Francis Dunn and Sister Jane Francis. We never turned anyone. Well, people would say, oh, because I'd make room, I'd make time,
Mm-hmm.
um, and you know, because of that, people trusted us, and I think that's one of your other things to talk
Yeah.
about was
Question
trust.
trust.
Just being there, being
Mm-hmm.
consistent.
Mm-hmm.
People that have, especially among the poor, they have been beaten around. And who do you trust? You get kind of scared. That
Mm-hmm.
was, I think, another part of a
Right.
question. And it's being there. It's the sameness. It is,
Mm-hmm.
you know, um, consistency,
Mm-hmm.
the desire.
Mm-hmm.
Hopefully, a lot of the ways is even humor and laughter too. I used to give away toys to all the kiddies. I wrote a letter when we started Buena Clinton. I wrote a letter to toy companies. Said, we're starting this free clinic.
Oh,
Could you give us some toys for when children get?
yeah.
I had a I had a room full of toys.
How beautiful.
And so here I am. I remember I had a toy box, and there was this little guy. He came in, and he had little overalls on. He just had his shots.
Oh.
So I said, you go to the toy chest, pick out toys. He started stuffing toys down his little overalls. He had toys.
Oh,
Oh,
Bubs.
and it was funny. And Sister Martha Marie was there. She ran the lab, and she looked at me, and I said to her, "Greedy little sucker, isn't he?" We started to laugh so hard.
Well,
We just let him take as many toys as he wanted. We had a room full of them. Why wouldn't we want to? But that sense of that we could give, and we had joy in doing it.
yes, definitely. And just as we're getting towards the end of our
Yeah.
conversation, what when you think about it, it's like has healing taught you about being human?
Oh, that's a very important one. Um, I look at my own life and ways that I needed healing.
Mm-hmm.
We all have areas of our life that need God's grace. Sometimes that's physical, and I had that with my heart.
Yes.
Sometimes it's emotional. Sometimes it's a sense of, like when I lost my mom this past year,
Mm-hmm.
I started to understand grieving in a new way that I touched on me that took me longer than I ever thought. Um, so in healing, we have the opportunity. God, I actually long time ago, I listened to a retreat on and I, and it started talking. We have our own woundedness, and actually, our own woundedness is special to us alone.
Mm-hmm.
It is through that woundedness that God calls us,
Mm-hmm.
and God heals us. Without it, we lose that sense of that need of God. That our
Mm-hmm.
own woundedness is specifically my own. I think if we try to truly talk about healing, we are brought into the most vulnerable times in people's lives.
Mm-hmm.
And sometimes we don't know what to do. I remember the first time I went to Santa Rosa, and that was my first healing in a hospital.
Mm-hmm.
Um, I was working at just my first day of pastoral care. They said, oh, go, well, you'll train and whatever. nobody was there. So Father Gamble said to me, well, go to First East and go to the front desk and tell them that you're from pastoral care. So I get there, and here I am, 22 years old. And they said, oh, good, this nurse at the desk. Oh, good, we have a man in this room. He just was told he's going to have his leg amputated. Could you go and be with him? Well, I didn't know what to do. I had no training. I went to the room, and he was crying in his bed. And he's like a 50-year-old guy. He was a construction worker and was
Mm.
going to lose his leg. He was face down in his bed, sobbing, crying. When I look at it now, I mean, they all broke so many rules, but I just didn't have any training. So I did what came naturally. And I remember sitting down on the bed next to him, and I
Yes.
put my hand on his back. He's crying in his pillow. And I don't even know what I said. First of all, you think about infection. You think about, you don't see that in patient. I mean, I think of all the things I did wrong. But zoom ahead about a month later, and Father Gamble comes to me, and he said to me, I got a letter about you from Bunny. Bunny was his wife. I don't
Ah,
remember his name, but
yeah.
he said the wife of this man said how you helped him accept what was going to happen.
Oh.
I don't, like I say, I have no, that's the Spirit of God. I
Mm-hmm.
had no training, no understanding. I did probably all the wrong things. And yet, Bunny writes a letter saying that you were instrumental in helping him accept what happened.
Wow.
God works through us. Paul talks about it.
Yeah.
God will give you the words to speak. He said those words to Moses,
Mm-hmm.
to Jeremiah, to Isaiah. Well, anyway, for certain those two, Isaiah,
Mm-hmm.
he says to all of them, because they say, I cannot speak. I don't know what to do. I will help you.
I will help you. And you
I'll
have
give you the
helped,
words.
and you've helped so many. Thank you so much, sister. Thank you for sharing your personal journey, your work in healthcare, and the important message of love,
Mm-hmm.
right? And abundance,
Yeah.
realizing that it's
Yes.
not just scarcity, it's
Yes.
abundance. So thank you for your time with us today, sister.
Okay. Thank you.
Thank you.
Thank you for asking.
Of
I appreciate
course.
it.
Thank you.